Okay, so two things we might need. We might need a pillow, and we might need like a broomstick or something we can just prop our arm up on top of. We're gonna use this in a shoulder flexion stretch. It's gonna look like this. So anything you can use for that, grab it real quick. We'll get started here in about 35 seconds here. What we're gonna go over some hip and shoulder mobility stuff, focusing on rotation of the hips and focusing on shoulder flexion. It'll help us get overhead in CrossFit when we get back into the gym. And some internal rotating stretches, just gonna really help stretch out most of our rotator cuff muscles, because most of our rotator cuff muscles are responsible for external rotation. So when we go into internal rotation, we're stretching those suckers out. A lot of those shoulder muscles can cause some issues if they get trigger points. We can get some pain down the side of our arm, all the way down to our elbow in some cases. So it's something we need to really pay attention to, and it's always good to stretch those things out. Okay. So we're gonna get started here. We're gonna get started in a 90-90 stretch. It's gonna look like this. Our front leg is out 90 degrees. Our rear leg is the same. Hopefully y'all can see that. I'm gonna turn to the side to show you what the back leg should look like. Okay? Pretty common to have this leg not quite in the right position. Make sure we're kicking that rear foot out far enough. Get in a good position. Okay? First, we're going to focus on this front leg. It's going to be mostly focused on external rotation. This is an external rotated position. We're going to keep a tall chest, and we're just going to lean forward. What I don't want to see is us rounding over like this, okay? We want to keep a tall chest, just hinging at this hip, and leaning forward as far as we can, again, without rounding our low back. We should feel the stretch right back here. These external rotators in our hip, primarily. These include the piriformis and some other little tiny muscles called gemelli that are underneath the piriformis. They sandwich the sciatic nerve as it goes through the back of your hip. When these muscles get tight, they can cause some irritation to that nerve, and we get something called sciatica, some shooting pain down the back of our legs. So this is really important to hold this stretch here. Stretch this muscle out. We're just going to stay here for a second and breathe. Whenever we stretch at the clinic I work at, it's called the Sports Pod, we always like to hold these stretches for 2 minutes. And the reason for that is we're really trying to make changes to these tissues. Whenever we stretch for any time less than 2 minutes, there's nothing wrong with it. It's still okay. But if we hold it for less than 2 minutes, what we find a lot of times is we don't see long-term benefits. We see short-term relief for some of our tight muscles. We feel a little bit loose. But we're not really seeing that long-term benefit that we're looking for out of these stretches. So that's why we're going to hold this for a pretty long time here. The second thing that's required to make changes to muscle is tension. And we're going to switch around to our left leg here, go into external rotation on our left side. The tension here should be pretty obvious, right? We're holding this stretch, nice tall chest, leaning forward, not rounding forward. All the tension's right in that hip, right where we want it. There's a lot of ways we can add tension to a muscle. Right now we're stretching it. Whenever we're working out in the gym, lifting weights, doing gymnastics, there's going to be a lot of tension on that muscle, right? Our muscle adapts, our nervous system adapts, and that's how we get long-term changes. That's how we get stronger, that's how we get fitter. Same idea here, just applied to mobility. We can also add tension with lacrosse balls, foam rollers, stuff like that, to work out trigger points, work out fascial restrictions in our muscle. I was at a dry needling certification the other day, or I think it was last weekend. This last week has been, what was it? Last week was the longest year of my life, right? It was last weekend. We did dry needling certification, and the instructor showed us some slides. He showed us some slides of a slide of tissue with regular dry needling, right, where we're not adding that tension. And how we add tension with dry needling is we actually put the needle in and we twist it. And the fascia wraps around the needle, and eventually it stops being able to twist, which is really interesting. And he showed us with a regular dry needling technique, or a lot of techniques you use in most acupuncture, right? You stick the needle in, you leave it, you get temporary relief. And the temporary relief is mostly chemical, right? So you're releasing actually opioids from your skin cells, your keratinocytes, which I thought was really interesting. You release opioids just from the needle being put in through your skin. And a lot of other tissues, all the other living tissues that the needle touches and aggravates, releases opioids, which is super interesting. So that's where you get the short-term benefits, the short-term pain decreases from dry needling. But the other thing that was really interesting is the mechanical changes that we see. I'll talk about those more in 1 second. We're going to switch into internal rotation stretch of this rear leg, okay? So we're in a good 90-90 position. We're sitting tall, and the big change, so we're going to go from here, from our external rotation, and we're going to sit our rear hip, try and sit that to the floor, and we're going to try and turn towards this knee, okay? Whenever we go into internal rotation stretches, we want to be careful if we're having any pinches in this upper thigh. We want to kind of ease out of that a little bit. Most of those pinches are caused by your rectus femoris, your main quad muscle that runs through the center of your thigh. It's actually not very activated in squats, rather it's activated in hip flexion. It's like a hip flexor that assists your psoas muscle. And there's one main part that runs up into what's called your your AIIS, which is just a little bump on the bottom of your pelvis. You can't really feel it, it's pretty deep. But there's another lip of your rectus femoris, that main quad muscle, that runs into the joint. And a lot of the times when we're feeling those pinches inside our hip, deep in our hip, that little strand of rectus femoris is getting impinged upon because we don't have proper joint mechanics in our hip. We don't want that pinching sensation. We don't like that pinching sensation. So if you are feeling that, ease out of the stretch a little bit. What you might be able to try is a little bit of distraction. I'll show you how to do this right now. What you're going to do is you're going to take your hand and you're going to press it against the back of your leg. Okay? You're going to lift your leg a little bit and you're going to push that leg out. And actually you may find a little bit extra range of motion there, and that's because we're distracting that joint. But like I was saying, with the dry needling course, I'm always a skeptic, right? So he told us, well, we're wrapping fascia around the needle, and that's why the needle is stopping when we twist it. I said, no, there's no way. Doesn't make any sense. Why would there be fascia wrapped around the needle? Doesn't make any sense. And he pulled up a slide. He said, here's actually a microscopic picture of fascia being wrapped around a needle. I'm like, damn, that's pretty interesting. Then again, after he showed us a study, the edge of the muscle, the fascia, before dry needling or with dry needling, before dry needling, with dry needling without the twisting, and with poking the needle in and twisting it. And 2 weeks after, there was a significant change to the fascia around the muscle. The fascia is just like this coating, like this blanket around your muscle. Fascia around the muscle actually remodeled. So it makes sense that however we can add tension to these muscles in this stretch, we're actually changing the fascia as long as we apply enough time. All right, let's switch over to the left side. Again, we're going internal rotation of this left side, so we're going to rotate over. We're going to try and sit that left hip to the floor. And we're going to try and distract that leg by pressing into the back of my leg, lifting my knee up off the mat, putting it back down on the mat, and stretching a little bit deeper. And I can get maybe an extra 5 to 10 degrees off that little trick. It's pretty interesting. So what we're doing with that distraction, we're adding a little bit more tension into actually the joint capsule. The joint capsule has a bunch of connective tissue interwoven throughout the head of the femur. And it holds everything in place. It holds your femur into the acetabulum, which is kind of like this little pocket inside your pelvis where the head of the femur goes into. I just did a video today. I posted it on my Facebook and on my Instagram, and it's on SportsPod YouTube, going over Tua Tagovailoa, Alabama quarterbacks, hip injury versus Bo Jackson. They both had hip dislocations, but it turns out Bo Jackson had a complication to hip dislocation where he tore his teres ligament. Inside the teres ligament, there's a blood vessel, supplies all the blood to the head of the femur. When he tore that, the head of his femur lost all blood circulation, lost all blood flow. Didn't happen to Tua, right? So Bo developed what's called avascular necrosis of the femoral head. Basically meaning the head of the femur just died. Your bone is living. Your bone is a living tissue, and if it doesn't have blood, it dies. It doesn't articulate properly. It causes a whole bunch of problems down the road, and that's what happened to Bo. It effectively ended his football career. Fortunately, it didn't happen to Tua. He got very good care, very good PT, and he was actually posting videos of him throwing passes today and stuff. That was pretty cool. Pretty cool to see. All right, and relax. If you don't have a broom, now would be a good time to grab one. First, let's do some internal rotation of our shoulder. Okay, so I'm going to move my mat here for a second just so you can see a little bit better. We're going to get in a sideline position, okay? Our arm's going to be directly out in front of us, and all we're going to do is we're going to take our other hand. We're not going to put it on the top of our wrist or on our hand. We're going to put it on our forearm here, right? We don't want to be torquing our wrist like this. We're focusing on our shoulder. So let's put tension into that shoulder by pressing down into the top of our forearm here, okay? So you should feel a stretch back in through here. What we want to try to avoid is us rolling back like this. We want to stay stacked up on top of the shoulder, stack that scapula into the side of the mat, and really press down with our opposite hand. So what are we stretching here? Like before I said, we are primarily stretching our rotator cuff muscles. Mostly our infraspinatus. Infraspinatus is a muscle that attaches from your scapula, your shoulder blade, and is our primary external rotator. This is external rotation. This right here is internal rotation. At the Sports Pod, we see a lot of problems that are caused by the infraspinatus. The primary posture that a lot of us work in, forward shoulder posture, right? We're actually stretching, we're actually lengthening that infraspinatus over the course of our day. If we're feeling a little bit of neck ache right here, we can grab a pillow or a yoga block in my case, and we can rest our head on top of that. Now you can see I'm actually able to get my arm all the way down to the floor. Okay, so let's switch sides. Go to our right side, stack on top of our shoulder, arm out in front, and rotate that shoulder down to the floor. So when we have a muscle that's lengthened for a long period of time or shortened for a long period of time, the muscle can get, number one, can get used to that length. Because usually what happens when you have a shortened muscle for a long time, happens a lot with our psoas, our hip flexor muscle. And it can trick your brain into thinking that's how long that muscle should be. So when you go from a sitting position to a standing position, that psoas doesn't like that length. So it tightens up, and it actually compresses into our lumbar spine. It connects from the top of our femur here, goes into our lumbar spine. What can happen there, you can imagine if you go from here to here, what's going to happen is that muscle, if it's too short, it'll actually pull on the lumbar spine and compress our lumbar spine. And that can cause a lot of pain. Kind of the opposite's happening here with our infraspinatus. It's sitting in a lengthened position. A lot of times when we stretch something, we can stretch it for too long. Because when we stretch a muscle, we're reducing blood flow to the muscle. You can't get blood to a muscle that's working isometrically, like an isometric contraction, and we can't get blood to a muscle that's in a stretched position. So we can have almost little mini spasms in our muscles called trigger points that develop. And what those do is, number one, they can cause poor biomechanics, meaning poor range of motion in our shoulder. Over time, that can cause shoulder pain when you overwork muscles that shouldn't be working, or pinching muscles because of poor joint mechanics. Another thing trigger points can do is they can refer pain. It's very common that we see, especially in CrossFit, some referred pain down the side of our arm. It's really hard to it's right here, but there's no muscle right there. You know, that's kind of like the deltoid. Deltoid isn't really a cause of a lot of issues, but pain gets referred there because of the kind of faulty wiring in the human brain. We feel the pain even though the problem is in a different area. It happens a lot with the shoulder, happens sometimes with the feet, happens sometimes in the knees, but it's very common with the shoulder and neck muscles called scalenes can refer pain all the way down to your hands and forearms. So if you have any of those symptoms, it's really important that you get someone to look at it for you. Try and figure out what the cause of the pain is. Instead of just icing that one area, you might be icing an area that really has nothing wrong with it. You might be feeling pain in that area, but the pain may be caused by something going wrong upstream, meaning higher up in your shoulder, higher up in your neck. Okay, let's come out of that. Hopefully by now you've grabbed a broom or a stick or something. You could even, I could even do it here on my railing right here. But I'll just show you the most common way we do it. So we're going to work in a shoulder flexion, okay? A couple things we want to focus on here is we don't want to go into lumbar extension. We want to keep our abs tight, and we want to keep that rounded lumbar curve. And what that's going to do is going to transfer all this tension to my shoulder, okay? So this could be a good lat stretch. Could be a good pec stretch. Whatever's restricting that shoulder flexion, this is shoulder flexion, this is shoulder extension. Whatever's restricting that shoulder flexion is going to get stretched in this position. And I think it's pretty obvious to all of us why shoulder flexion is so important. to us in CrossFit, we do a lot of stuff overhead, right? We do a lot of overhead presses, a lot of snatches, a lot of jerks, a lot of dumbbell snatches, stuff like that. All requires a good amount of shoulder flexion. And remember earlier, I was saying that we want to avoid this lumbar extension. Why is that? Why do we want to avoid that? Because a lot of times CrossFitters compensate for lack of shoulder flexion with lumbar extension. Okay? You see how much more shoulder flexion I can get when I round my low back like that? If I keep it arched like this, I lose a lot of that. This compensation can cause a lot of issues. Number one, if we have lack of shoulder flexion, that can cause issues on its own. It can cause impingement, can cause strains in our rotator cuff. No fun, right? But what a lot of people don't understand is that when you have poor shoulder flexion, that can cause poor biomechanics of our lumbar spine and cause back pain. It's crazy, but it's true. We see it a lot. We see a lot more injuries coming from lumbar extension than we do lumbar flexion. Like with poor deadlift form, we really don't see it that often. Of course, with poor deadlift form, we can switch arms here. We run the risk of something catastrophic, right? Like a disc bulge, disc herniation, something that's really going to put you out for a couple of weeks. But it's very common that we see what we kind of refer to as facet syndrome. We have these joints in the back of our lumbar spine called facets. And when those facets get jammed up together, and especially if you combine it with a tight psoas, which is very common, compressing that lumbar spine, in combination with poor biomechanics, those facets can get very irritated, cause a lot of pain, irritate the nerves that are around that joint. Pain, inflammation, and it takes a few days for that to get treated too. It takes even longer how to learn how to move our lumbar spine properly. In order to avoid that injury getting re-aggravated, right? All right, and relax. Good work today, team. For those of you who are watching it on replay, I believe that was about, it looks like that was about 20 minutes, 24 minutes. So we can check that box off the bingo thing. Go ahead and screenshot this, tag it, post your bingo card, post it on your social media, tag me, tag CrossFit Luna. I think our lunar rover, right? So like 3 total R's, lunar, hashtag lunar rover, hashtag CrossFit Luna. Let's try and box it out. Give me some feedback. Tell me what you think. I'm stuck at home like a lot of you are. So if we can keep this going for a long period of time and people want to watch it and people want to do it with me, I can definitely talk into a camera for 20 minutes. Once a day, I need someone to talk to, right? So thanks for playing along. Thanks a lot, and give me your feedback. Tell me what you think. Tell me if you want to do it again. And if that's the case, we'll do it again. See you later.